Good evening, everyone. Welcome to our webinar on treating painful emotion with mercy. I'm Dr. Denisa. If you have done a webinar with me before, then it's great to have you back. If this is your first one with me, then I welcome you here. I'm excited about this one. I am starting sharp at 7 o'clock because my hope is to keep this webinar exactly 30 minutes long and not go over. I do tend to go over because I like to talk and I talk a lot, but I'm going to try to keep it for 30 minutes so that I can keep your attention with me. But let's get started. So if you don't know me, if you know me, you already know all this stuff about me. But if you don't know me, let me do just a little brief introduction. So I am an Atlanta-based licensed psychotherapist and a psychologist. My specialty is trauma, but I also treat clients with anxiety disorders and mood disorders, and a variety of other issues. I also do clinical psychological evaluations and trauma assessments, and of course therapy. I'm also a professor of counseling psychology at a Yorkville University in Canada, and I am a certified professional clinical supervisor, which means that I train other therapists towards their licensure. I have been in the field of clinical psychology for over 20 years, but besides clinical psychology, I also specialize in counseling psychology. I have done a lot of forensic work as well as performance psychology. If you want to know more about my work and my credentials and experience, I would encourage you to visit my website. It's just my first and last name, denisemilad.com, and you can certainly learn more about me there. Okay, so let's look at our agenda for today. So we are going to talk about what are painful emotions and why we tend to avoid them. We're also going to look at what are some of the consequences of avoiding a negative or painful emotions, and what we can do to really establish some healthy processing habits when it comes to painful emotions. I'm going to teach you specifically one technique. It's called the mercy technique. And then I'm going to share some of the things that are coming up that I will be doing in the months of June and some ways of being able to stay in touch. So let's look at what are painful emotions. So here's a nice little definition. They're really intense feelings that arise from non-physical sources and can cause significant distress. So oftentimes they stem from experience such as regret or grief or loss or even the actions of others. These emotions can also be linked to mental health conditions like mood disorders, depression, or anxiety. Commonly associated with emotional pain are feelings of deep sorrow, sadness, loneliness, panic, rage, shame, but also a sense of worthlessness. So why do we tend to avoid painful emotions? So people often avoid painful emotions for several reasons, all of which are usually driven by fear. So here are some key reasons why we might steer clear of confronting our emotional pain. So first of all, number one reason is fear of vulnerability, because admitting to emotional pain can make us feel exposed or weak, and especially if societal norms have taught us that, we associate strength with emotional stoicism and not really feeling much. Another reason is a lack of trust. So sometimes we may have past experiences of having emotions manipulated or dismissed, which would then lead to a reluctance to share feelings or fearing that they will not be taken seriously or handled with care. Another reason is self-protection. Avoiding painful emotions can be also a defense mechanism, right? Because we are trying to prevent further emotional distress. In terms of another one is denial. So sometimes people just may not want to acknowledge the depth of their pain, believing that ignoring it will somehow make it go away. And lastly, coping strategies. So, people may engage in various activities to distract themselves from their emotions, such as overworking or sleeping too much, or even focusing on other people and helping other people, which will temporarily provide relief, but it will really not work long term. So let's look at some main consequences of what happens when we avoid our emotions. So when we avoid painful emotion, it can have pretty significant consequences for our well-being. So here are some key points. So the number one is the physical and psychological impact. Repressing or suppressing negative emotion doesn't really make them disappear. Internally, these emotions can create almost like a raging fire that affects us in various ways. Lots and lots of research out there shows that mental threats are actually processed similarly in the brain as physical pain. So it's essential to recognize that emotional pain is very real and it can impact your overall health. So some of the disorders that are associated with emotional repression are any kind of chronic diseases, chronic conditions, including chronic pain, but also heart diseases. Suppressing emotion is associated with higher rates of heart disease, as well as autoimmune disorders, because suppressed pain and kind of a chronic stress that it creates really weaken our immune system, which means that we're set up for all kinds of physical issues, including gastrointestinal issues. Pushing feelings aside can be linked to developing ulcers, IBS, and other gastrointestinal complications. Another problem is a relationship challenges. When we are avoiding our emotions, it can really affect our relationships with other people. People who avoid emotion tend to experience higher pain levels, and like I mentioned, issues with their health, and additionally tend to struggle with depression and anxiety, which will then also affect the quality of their relationship, because it feels like, if I'm always in pain, if I have concerns about my health, if I'm depressed, I'm probably not going to be very fun being around. I may have trouble communicating. I may be hiding how I'm feeling because I don't want to be judged. And that is going to be picked up by our loved ones, by our partners, family members, and it's going to create strain in our relationship. Lastly, awareness and vulnerability. So learning to be vulnerable really means allowing yourself to actually not just feel pain, but also process it and then continuing to move forward. So awareness and vulnerability are essential for successful relationships in all aspects of life. So, in summary, really, avoiding painful emotions can lead to suffering, both physically and emotionally. On the other hand, acknowledging and processing our feelings is crucial for our well being. Okay, so let's look at some ways of healthy processing of painful emotions. So there are actually some steps to this, but the very first step is just labeling your feelings. Really like naming the emotion that you're experiencing, putting a name to what you are feeling. Expressing emotions in words can actually diminish their intensity. But the shift kind of happens from I am sad to I'm having this feeling, to create somewhat of a distance from the emotion. So notice the difference if I say, I am sad, I'm having a feeling of sadness. There is no more of this cognitive fusion with the feeling, but rather we're creating some distance, but we are very much acknowledging and naming the emotion that we are experiencing. Number two, acknowledge and express. So again, avoiding bottling up emotions. Acknowledge and express them through really healthy outlets. So this could be journaling, it could be talking to a friend, or it could be seeking professional help, right? Working with a therapist. And not necessarily talking to people because they will give you a solution or an answer, but rather seek people who will just be, a listening ear, who won't necessarily come up with advice and solution for you, but just be there so that you have an opportunity and a chance to verbalize what you are experiencing and get insights into your own feelings just from verbalizing what it is that you are dealing with. Number three is practicing mindfulness. So when it comes to practicing mindfulness, stay present with your feelings. Mindfulness and meditation practices really help you observe emotions without judgment, allowing you to process them more effectively. Being in the moment, allowing yourself to be with it. Creative expression is also really, really helpful, using art or some kind of creative activities to translate emotions into something tangible. So, and this creative expression can be writing, it can be expressive writing, it can be art, it can be drawing, it can be music, it can be dance. It could be so many different things that will just provide relief. And physical movement, engaging in physical activities to release emotional energy and really change your physiology, because we cannot change our emotional state without changing our physiology, the physiology of the body. So, there's so much talk about the mind-body connection, and mind-body connection is very real. And so if the mind and body is connected, that means we can actually work with the body to affect our mind. Okay, so very important. And any kind of exercise, dance, movement, yoga, such powerful outlets for processing emotions that we're healing. So remember that healing from emotional pain is very possible, and there are ways to do it, very healthy ways to do it and navigate it. So let's look at this technique, the mercy technique. It's a really, really wonderful and helpful technique, but like any other technique, it will need practice and consistency. So if you are like most people, you may have a tendency to kind of clamp down on your emotions in general, but especially on those that overwhelm you or just feel kind of undesired. Like, I don't want to deal with it. I don't want to feel it. Oh no, I'm getting anxious. I don't want that. I'm feeling sad. I don't want that. So the mercy technique is a technique of self-compassion. It's a very important skill for tending to painful emotion. But like I said at the beginning, it's going to take some practice, and potentially it's going to be initially somewhat uncomfortable to use it. So it will take you allowing yourself actually being vulnerable and treating painful emotions with kindness and mercy. So it is an acronym. So you can look at this acronym on the slide here to help you remember these steps. And I will, for those of you who are here, you obviously had to give your email address to get the link. I am going to send these slides to you afterwards as a PDF so that you actually have this, okay? But using this acronym on the slide to help you remember the steps. So the M stands for meet. A first step is to just meet your emotion. It's almost like picture opening a door and acknowledging your emotion being there. Here is my sadness, here's my anxiety, here's my irritation. Notice, not I am sad, I'm anxious. It's here's my sadness, here's my anxiety. Take a deep breath and notice what happened. Instead of shutting the door and pushing it away, you actually did the opposite. You welcomed it in. So that's M. Moving on to E, engage. So here, I want you to picture yourself being calm and curious as opposed to judgmental about your emotion. So what is your emotion telling you? Emotions are just signals about something that's happening with you. So what do you need to, how can you get in touch with your thoughts surrounding this emotion? What do you need to ask yourself? What do you need to pay attention to in your environment? So engaging really means like being an observer, okay? So moving on to R, and the R is for respond. So in response, I would invite you to offer compassion. It's almost like you talking to your emotion. I hear you. I'm with you. Breathe, offer gentle support, because fear needs reassurance to calm it, right? Sadness needs comfort to lighten it. Irritation needs understanding to soothe it. So offer words like, this is hard, one breath and one day and one step at a time. This is unfair and frustrating, but we'll get through it, right? So that's the compassionate, calming response. C, moving on to C. C is for calm. Calm your body. So here we go back to the change in physiology, right? Working with the body, calming your body. Breathe, walk, stretch, ground yourself. Feel the emotion in your body and attend to it, giving yourself a tender care. So remember, when we are with this negative, painful emotion, and we're just sitting with it and we're acknowledging it and recognizing it and responding to it in a calm manner, doesn't mean that we're gonna stay in this state forever. Doesn't feel good to stay with that, but we have to allow time for that engagement and the processing so it can be released as opposed to suppressed and repressed, where it's causing all the issues that I talked about at the very beginning. And finally, why stands for yes. Yes is really kind of like a celebration here because you actually allowed yourself feel the emotion, and it's really important that you acknowledge that. You walked on a new neural pathway. You literally just made a new neural connection because you've been doing the same thing. I'm feeling emotion, don't want to feel it. Let me suppress it really, really quick. Let me eat something, let me drink something, let me work too much, let me go to sleep, whatever it is, just make sure that I don't feel it. And this is the opposite. I'm allowing it in. I'm welcoming it. I'm talking to it. I'm with it. I'm sitting with it. And then I can let it go. Totally new neural pathway, right? So when we talk about the neuroplasticity of the brain, there are like so many millions of neurons in your brain and so many connections, and there's such amazing neuroplasticity in your brain, and we can always grow new ways and create new ways of how we are dealing with these emotions, even though we may have had habits over years of suppressing and repressing, causing all kinds of issues in our life. So this is the mercy technique. It may be really helpful to do this as a journaling exercise. So you literally just follow these prompts. You writing down the prompt about meeting the emotion and then how you engage with it. What are you actually exploring? Why am I feeling this? What's happening? What do I need to pay attention to? Responding to it, calming your body through some gentle care, and then really celebrating and recognizing that this is this is what you have done for yourself, and it's a huge, huge, huge victory. Okay. So simple technique, but like I said at the beginning, doing this at first may feel somewhat vulnerable. Maybe even for some of you, it may feel a little silly. Um, and it certainly can get somewhat uncomfortable because you are doing the very opposite that what you may have been doing up to this point, right? So I would love for you to give this a try because you don't need anything else than anybody else to work with painful emotions. And if you're consistent enough over time, you won't even need to really think about it. Now, when you're starting now and you're learning something new, it's like you have to think through the steps and you have to follow the acronym. But over time, as you practice this technique, it's going to become a very natural way for you to process emotions. They're going to come and then they're going to go because you will be dealing with them. They're not going to get piled up to, inside of you and then lead into all kinds of host of problems. So that's the mercy technique that I wanted to show you tonight and talk about tonight. I am now going to move on what we have coming up because we have 3 events in June that I'm excited about. So for you who have done this with me, we have the little tea chat, which is really just an hour. It's all ladies at these tea chats, and we're just kind of chatting about different life issues. The women in these groups are typically women of different ages and backgrounds and experiences, and it's not like a webinar. We actually see each other's faces and there's interaction. It's kind of like a drop-in thing. So if you're not on my contact list and you would like to know more about it, please send me an email, and I'm going to share my information in just a little bit. And I will send you an invite to it, but those are always fun. And I think in this month, in June, we're going to be talking about the benefits of reading for cognitive health. So it's going to be really great. The next one is the next webinar in the free webinar series, and we are going to continue working with difficult emotion. And this time we're going to do a safe space meditation and visualization practice. It's a very, very effective technique that I will do and guide you through a meditation practice here. And then lastly, at the end of the month, we are going to have Empowered Relief. So this is a 2-hour class that's developed by Stanford pain psychologists and scientists. I have gotten certification in Empowered Relief. And what we work on is how to manage chronic pain. So I think this class is really powerful. The material in it is amazing, based on lots of evidence-based practices and research. So I'm very excited to share that with the community. So again, if you are interested in any of these, like I said, I'm gonna email you the PDF of these slides, and you can see the contact information here. So you can email, you can call, you can go to my website, just kind of look around. We also have a Facebook page where I am posting lots of these different events that we're doing. And if you notice, my private therapy practice is actually called Safe Emotions, but all these things that we are doing online are under the DM coaching, and that's because we want to make them accessible to people that could be just about anywhere in the world and not just in the state of Georgia. Because with therapeutic practices, we have to follow the licensing rules, but with coaching and webinars, we can provide them to people just about anywhere. And then the last one is, yeah, I started a little YouTube channel just because many of my clients need and want recordings of different exercises that I do in sessions and meditation practices. So right now it's very small. It's maybe only about 7 videos of different meditations that I do. I recently uploaded a recording of a sensory awareness practice, which is a grounding technique, which is really, it's not a meditation practice, it's a grounding technique. So if any of you are struggling with things like dissociation, or really sort of being hijacked with emotions and having trouble regulating, it's very effective. So in that particular recording, I am asking you maybe 21 questions that really make you focus on sensations in your body and different feelings that you're experiencing. And so it will help you get grounded in the present moment and kind of connected with yourself again. So it's there for you. All of this is free. So I'm hoping that it helps at least some of you. You feel free to share it with other people. And I think I am doing absolutely marvelous, because I see that I've said it all in about 27 minutes. So I am looking, I am going to allow like a minute or two if you have any questions to put into a chat or the Q&A. So I will be silent for just a moment, just kind of see if anything shows up there. But if not, we will just wrap it up for tonight. I'm recording this. And I will put this recording on the YouTube channel as well. So if you want to see it again or share it with somebody, it will be there also. Alrighty, I don't see any questions. So I just want to thank you all again for coming. Thank you so much for being here. And I am hoping to see you at another event in June. Have a great night, everyone.